Started, I don't know if the speaker's working or not, but I think everybody can hear me, and I'll try to be loud. So our purpose today is actually I'm going to hopefully get everybody familiar with at least some of the reptiles around the area here in Idaho. We're going to limit it to Idaho, but the main purpose today is to get you to be able to recognize the venomous reptiles that you have in the state. And there's 3 of them, 3 species of venomous reptiles in the state. And we'll go through those, and I've got pics of them. And we're going to understand their behavior, their habitat, and then we'll do a little demo. And then I'm going to talk about what happens when things go bad in the wilderness and here in the hospital. So when things go bad, what do we do here? So it's very open. Ask questions. Feel free to come up as we bring some critters out. Feel free to come up and take a look. I'll tell you which ones don't get real close to, but you'll see that. It's pretty obvious.
Hey Doc, when we bring the white ones out, make sure they lock the doors in the back.
Okay. I'll do that. We always lose 1 or 2, so if anybody sees one going around, just let me know. So, I'm Greg Moore. I'm one of the ER physicians. I've been doing it for longer than I like to admit. I've been 39 years boarded ER physician, and also been in wilderness medicine and a fellow in wilderness medicine since 1989. So I've been doing wilderness medicine lectures not only around this area, but around the United States and now around the world. And most of my favorite is venomous reptiles, as you'll figure out, because I don't usually stop talking. I just keep going and going and going. This is Roger Seaman, a good friend of mine who is also retired Forest Service worker. He is by even his own admission, he didn't start off liking snakes, but then started to understand their behavior, and as far as habitat expert, travel expert, how do they migrate, he's the expert. He relocates, and he can dispel a lot of myths about relocating the dens and things like that, which you can do safely. And cohabitation, which that's what this whole thing up here is for. When you get in a little bit, come up and look, because there's a lot of myths about bull snakes and rattlesnakes. They eat each other. Yes, that's true. And one can eat the other, and the other can eat the other one. And rattlesnakes will eat rattlesnakes. We found that out too. So, but they cohabitat just like that. They've been in there how long now?
I put them in this morning, so they're just
you're just getting to know each other right now.
The little guy is still in there, so they haven't eaten yet.
Yeah, there is a little baby in there, by the way. So there's a little tiny baby rattlesnake. So with that said, I'll get started. This is not one of your local snakes. Anybody know what that is? What's that? Like, no, this is actually an eyelash viper.
Oh.
Yeah, this is an eyelash viper. This is one of the pit vipers of Costa Rica. This is a picture that I got when I was down there. I've got a couple from this past year when I was teaching down there. They're actually really small snakes. This is one of the biggest ones. And pretty high morbidity and mortality because they usually are on branches which you walk right by. And then you don't see them. And they're so colorful. You just don't see them. It's called an eyelash viper. But we don't have to worry about those here, so don't worry about that. So let's talk specifically about Idaho. I'm happy to answer any questions about other areas of the United States. I've given this talk in Arizona, which is probably the coolest state if you like snakes to live in, because it has almost 18 of the 21 pit vipers down there in Arizona. So if you like venomous snakes, Arizona's your place. If you don't like it, I stay in a cold environment, as you'll see. Okay, so today what we're going to do is try to understand the snakes. Snakes really don't want to bite humans. And the fact that you startle them is pretty rare, as I'll point out. It happens less than 20% of the time now. It's usually people that got too much to drink that say, oh, I can catch that snake, and they reach down and the snake catches them. And they just harass the snake. And I hope to demo that not being bit. I'll bring Bruce up to do that. I don't want to, but hope to demo that these snakes really don't want to mess with you. They kind of want to stay away, and so we'll actually do a live demo, and we'll see how that works. So, okay, we understand their habitat, and then the signs and symptoms of envenomation, when to worry, and then the current field treatments for bites. And there's actually some new hospital treatments, or some new protocols that we're doing now, and actually Joel had talked to me earlier. There's a new anti-venom out that's been in development for about 5 years now, out of a horse serum again, but it's a fad fragment, and I'll talk about that. The advantages and disadvantages, which we're not finding many, and the cost difference, which there is none, by the way. So, but anyway. Okay, just to put everything in scope of where we're at, there's about 3,000 species of snakes and about over 7,000 species of lizards. Interestingly, about 700 of the snakes, so about 20 to 25%, are venomous. And only 2 species of lizards, both of which are in North America, and that's the Gila monster, and then the beaded head lizard, which is the relative of the Gila monster that lives in Mexico. And they don't have like big venom sacs, but they have grooves in their teeth, and we're not going to talk about them because they're not down here either. But they have grooves in their teeth, and their saliva has a neurotoxin in it and an irritant in it, and they bite hard. Gila monsters bite hard. So, in the world, there's about 4 species of snakes, families of snakes that are venomous, and of that, the Atractospids, which we don't have here in the United States. These are the burrowing asps, the stiletto snake. They find them in the Mideast and Egypt. The interesting, cool thing about these snakes is they can bite sideways. So, in other words, I hopefully will be able to pick up the snake, and it could actually turn its head sideways and envenomate me, where the pit vipers have to come right at you and hook you. And the elapids, which are the largest species of venomous snakes, which includes this one. Anybody know that? Mamba, black mamba. How fast can they run? Faster than a human. So they can run about 14 miles an hour. They grow up to about 15 to 18 feet long. So, and they can climb a tree over half their body length. So they can actually lift themselves up, take their head and pull themselves up in a tree. So fascinating snakes, we're not going to talk about them. Other than that little bit right there. And then the vipers, and we'll talk a little bit more about vipers too. Colubrids are what we traditionally call non-venomous snakes. The bull snake's a colubrid. The garter snake, which we have around here, are colubrids. We're finding out now that some of colubrids have venom, and they actually have a modified gland that produces venom, so it can cause irritation. And worldwide, there's a couple of colubrids this is a colubrid. So this is our friend Bill, and I'll get everybody up close here in just a little bit. But Bill's a friendly snake, but sometimes. But unfortunately, his markings kind of fool a lot of people, and because he looks a lot like that prairie rattler in there. So, okay. This is so narrowing it down. North America, 2 lizards, 80 venomous snakes. United States and Canada, we're down to 21 rattlesnakes, 2 echistrodons, which are water moccasins and the copperheads, are 2 of them. We only have 1 species of each in the United States. 3 coral snakes out of 73 that are in the Americas. There's 73 species of coral snakes in the Americas that are unique to the Americas. These are elapids, and we only have 3 of those species. And then 1 of the 2 lizards, the Gila monster. So,
Doc, what's the most poisonous snake in the U.S.?
By venom, the Mojave rattler. Probably, it has a very, very potent neurotoxin. But this guy is up there with it. Then this is the one we have here. This is our prairie rattler. So in Idaho, what you're going to run into in the woods here, you may see a rubber boa if you're lucky. I'll show pictures of that. Rubber boa is of a different family, totally docile snake, very friendly. They use the snake to train people that have phobia or fear of snakes. because it just doesn't bite. And then the colubrids we have here, 2 garter snakes, gopher snake, which is the other name for bull snake, ground snake, and I'll have pictures of all these to help you recognize these. Then we have racers, ringneck snakes, and whip snakes. But of the 3 species that are venomous, the vipers, it's the prairie rattler, which is all round. That's what you're going to run into in the fields. And then they're out now. In the panhandle, northern Pacific rattlesnake, very venomous snake, something to know about because this is one of those snakes that if you're bitten by northern Pacific rattlesnake, you automatically should be in the hospital in at least 12 to 24 hours because they have a delayed neurotoxin. And so a lot of people, they go home after 6 hours, that's fine, and they wind up having a lot of trouble breathing after that. So, and there are in Idaho, not many. Then the gray snakes and rattler, which is actually a sister of the prairie rattlesnake. And so, worldwide, 2.5 million bites. And who knows? There's probably a lot more than that, but they don't keep stats like we do in the United States. You get bitten in Costa Rica where I teach clinics down there. Most people don't even go in, so they never know. You know, little Johnny died. Well, that's because he was bitten by a furlance when he was going outside at night, and nobody keeps records of that. It's sad, but that's what happens. Africa's the same way. Lots of mamba bites that aren't reported. So they estimate, 125,000 deaths, but actually they're 250,000 deaths a year, and who knows? And no morbidity. This actually is a kid from Costa Rica that came in and they thought he had gangrene, which he did, but that was from a furlance fight, and it happened like months ago. So. Okay, in the U.S., we actually have pretty good stats. Almost every year, there's 8,000 of us that are dumb enough to play with snakes that usually get bit. So, I haven't been bit yet. So, but I'm getting slow a little bit. So, but of that, about 2,000 are treated. So, really, of the ones that are envenomated, 50% are treated. So, of the 9,000 bites, think about 25% are drugged. So that's going to knock off about 1,500 to 1,800. And then of that, half of them are treated with antibiotics. And some people just don't go in. Less than 10 deaths, but there is high morbidity in the United States. So how to recognize it? This is one of my favorite slides. Somebody sent me this from Dylan. It said, do I have a problem? About this time of year.
Eastern Montana.
Yeah. And they said, do we have a problem? And I'm like, yeah, definitely. I wouldn't send your kid down to that culvert there. So those are all prairie rattlers, all balled up and just kind of stay warm. Okay, I'm showing this for everybody's benefit because you're going to see it in the books, but look at it, pay a little attention to it. I'll show you the high points and forget about it. You should really just go by what's in your area, like your venomous snake. So traditionally, the non-venomous, which were the colubrids, and we know that I've already said that a lot of colubrids have venom too, have round heads, but some have triangular heads. Pit vipers have triangular heads. Pupils are round, so if you're close enough to look at their pupil, they're round. There is a cat's eye boa that lives down in Costa Rica that has an elliptical pupil and looks exactly like a poisonous snake, but it's not poisonous. None of these rules hold true. But in the United States, basically triangular head, vertical pupil, and facial pits. This is the big one. Facial pits are, that's the sign. We'll talk about coral snakes briefly. We don't have them here. We identify them by color. But once you go south of the border, that falls apart too. In America, red, yellow, and black. And we'll talk about how to identify that. There's a prairie rattler. We'll show you one live and personal. But what they have, elliptical pupil, if you decide to get this close to look. nostril, and the pitch. Everybody knows what the facial pitch for, right? That's how they sense their prey. It's actually an infrared sensor that they have, and it's about 180 degrees, and they can't see worth a hoot out of their eyes. They can make out objects, but that's about it. But they sense with that pit, and it's an infrared sensor. And anything that moves, and we'll show that, where like I'll walk around it and you'll watch its head go around, just follow them. But you take something cold and move it around, it won't move at all. So it's an infrared sensor that they have. Okay. So further identification, and this is wrong too, again, but you'll see it in the books. Non-venomous snakes don't have fangs. I'll show you a skull of a non-venomous snake. And they have fangs. Pit vipers have long, retractable fangs, and coral snakes have short, thick fangs. And I've got pictures of that. And if you still don't know, you can roll them over, and right after their anal plate, their scales are still vertical. And I'll show you pictures of those too. So let's see what we got. This is a fur lance. They call them lance heads because their nose is pointed. I don't know whose hand that is besides mine. But anyways, these things are like hypodermic needles. Clear but sharp as razors. That snake right there has about a 25% mortality if you're tagged by it. But their fangs fit up in mucous membranes up here in their upper lips, and then the glands that have the venom are called juvenoid glands, and that's where the venom is made. And we can talk a little bit more about that too. This is a rattlesnake. This is Western diamondback, and it actually has 2 fangs. So people say, well, if you defang a snake, it's going to be safe. If you defang a snake, the teeth rotate and another fang forms. So you defang it, and they rotate again, and another fang forms. So don't buy a defanged snake if you think it's safe. So it will grow new fangs. This one actually has 4. It has 2 on each side. The front one is the venom apparatus. So if that one is broken off, that one will come into play. There's, if you want to flip them over. There's their anal plate right there. And then see how the scales are horizontal, just like their belly. In a non-venomous snake, like this bull snake we'll show you in a minute, it's split. So, but not too many people have volunteered to do that. So, okay. Rattles. Most all rattlesnakes have rattles, but a lot of times they'll break them off, and they always don't rattle right before they bite you either. The Keystrodons, by the way, water moccasins, they don't have rattles. Neither do the copperheads. They're very silent, no warning. You just have to know where they're at. And then the color is variable, and you'll see the picture. But coral snakes in the United States are red, yellow, and black. But even that's confusing because there's a couple red, yellow, and black striped non-venomous snakes as well. King snake being one of them. King snakes in the Midwest, a great mouser, great asset if you have a lot of rodents around your house. Okay, here we go. In Idaho, this is a rubber boa. Anybody caught one of these? Seen one? Pretty cool, aren't they? They kind of look like worms. They call it a 2-headed snake. It's actually the boa family. They're constrictors. They feed on small mammals and rodents and bugs. And you wouldn't think it because they just don't bite. They just squeeze and then they swallow. So colubrids, originally thought to be non-venomous, their venom is mildly toxic, and this is what their head looks like. These are their glands. See those glands are right there, or fangs right there? Those are fangs, and that's in the garter snake's mouth. See them over here? Right there? That's in the garter snake's mouth. And they will secrete a venom that can be irritating to the skin. A couple of snakes worldwide in this family have been implicated as causes of death. And this is one of them. This is called a boomslang snake in Malaysia. And beautiful snake, but they can deliver quite a nasty bite. Around here, we've got these. I'm sure everybody's seen these. This is actually a terrestrial garter on that side, and then the other one is a common garter snake. They should be around everywhere. This is a ringneck. Everybody seen these here? They're real common in the Midwest, and I was quite surprised to see ringnecks on the list here in Idaho. I've never seen one in Idaho either. One of my favorite snakes to catch of the colubers, this one actually has a fairly decent amount of venom, even though I've never been bitten by one. They're pretty docile snakes too. This is a night snake. Very, very rare snake. It was on the endangered species list, and I think they just took it off. But it's endangered mostly because of these markings, the color of it. The markings on that look a lot like that guy right there. No, this one's not. Yeah, yeah, but they're mistaken for a venomous snake and kill it. Okay, this is called a long-nosed snake. That red, yellow, and black one's a long-nosed snake, and the one that's inside is a racer. Both fairly aggressive snakes, but not much in the way of envenomation in these groups here. And this is a whip snake, and the picture fits its name. Really thin and skinny, and the other one's called a ground snake. Again, in Idaho, fairly rare. The ground snake's fairly rare, mostly nocturnal, rodent eater, very docile as far as aggressiveness. And this is our friend, which I showed you. That is a bull snake, or gopher snake, as some people call it. So, yeah, I'll grab him in a second. You got him?
Yeah, I thought you were right.
Not quite. Like I say, I like to talk. So. Okay, let's talk about the vipers. There's two types of vipers, not just briefly. True vipers are like the Russell's viper, the Gaboon viper, which everybody's seen pictures of, I think. And then pit vipers are what we have in the United States. So this is a Gaboon viper. It's fat, it's slow, but it's got such a potent chemotoxin that it causes a lot of morbidity and mortality. It's endemic in Africa. Fangs are 2 inches, just a little over 2 inches in length. Massive amount of venom through the liver. We don't have those, so these are the ones we got to worry about. The Crotalus viridis is the prairie rattler, endemic all around this area. So that's what we see. That's what we see in Montana. That's our only venomous snake in Montana, is the prairie rattler. And that's what you see all around here, in the valley and along the river and up on the hillsides right now, because they're coming out out of their dens right now. So this is the one I was talking about earlier. This is a what they call Northern Pacific rattlesnake. Quite a venomous, one of the top 5 as far as envenomation it goes. But it's mostly in the Panhandle and southern and western Idaho. We don't have any in this area. But this is the one, if you happen to be in that area hiking and you encounter this snake, or certainly get tagged by this snake, hopefully the local providers will know that this is one you just don't say, oh, that's probably a drive-by and send home. These need to be watched for about 24 hours in the hospital. So they have a very, very potent neurotoxin that will stop respirations if gone unrecognized. And then a sister of our prairie rattle is this Great Basin rattle, and that's in more, again, in southern Idaho and right up in the Pocatello area, in that area, the drier parts. Okay. So the diamondback has that sensory ability, that infrared sensing, which I talked about. And then, what's their tongue for, by the way? They taste the air. They can taste every single one of us. I don't know what it tastes like, but for them, that's when that tongue comes out, it flips up and down, they're picking up scents with their tongue.
Yeah, especially like girls.
Yeah. Okay, pit viper strike, as you're going to see, 10 feet per second. So if you think you're fast, come on up. Come on up. How much antivenom do you have? One person. Okay. All right. 10 feet per second. And they can strike half their body length. The only exception to that is what they call a jumping pit viper in Mexico. Can jump its full body length, so you want to maybe keep a wide berth. If you're down south of the border, keep a wide berth in the snakes. First off, some of them are quite venomous, and second off, there's not good healthcare facilities down there as far as anti-venom goes. So, all right, so let's talk, and I talked about that. So let's bring them out. All right, this is a colubrid. This is a bull snake. Kind of round eyes. There he's tasting everybody. See? Like that. Safe, safe. These get mistaken a lot for prairie rattlers just because of their color. And the problem is, these are actually... Yeah, yeah.
I do want that backup one.
This one, age.
I just got it.
Yeah, but he's got to be about 3 or 4 years old, I bet.
You're the expert, I don't age him.
Yeah, I was going to say, he's probably about 3 or 4 years old.
This looks pretty similar to the rattlesnake with the tail.
Had it one time.
Look at the tail. The rattlesnake doesn't have
Like
this.
everything else you don't know, they taste like chicken. They kind of
Did you ever get to try it?
Like Doc says, the most snakes are good to have around. And try not to kill them. I found this one dead on the road one time, so I just tanned it and stuffed it.
You've only had this big one for a couple days?
No, I got more.
No, this big one. When did you get that one?
A few
Where did you?
Oh. I've got about 20 of them. But relocating some in new areas where they want most snakes, they don't have them. So, caught about 20 or 30 bull snakes and we're relocating places that want those. We're putting them into rattlesnake dens. And they'll relocate, they'll accept that rattlesnake den. It's a touchy thing.
Yeah.
Herpetologists say it works. We've been doing it for
Bull snakes, when you kill a rattlesnake, you'll see them kind of spar.
Sorry. Paul, get it off of me. Get it off of me.
Like together because of territorial things, like they both prey on the same prey.
We were talking about this on the way down, because in the den, these things cohabit all winter long, all balled up together.
The truth. The truth.
Yeah.
Go ahead. I told Doc that they live together, they eat each other, but when they go into the dens, they sign this little truce.
Yeah.
Everybody behaves, we don't eat each other until we come out in the spring.
Yeah, and then when
And
they're
it works.
aggressive,
They don't
hunting,
kill.
yeah, when they're hunting, they may actually attack each other. Rattlesnakes don't attack rattlesnakes, so, but these are great rodent eaters right here. They're good mousers.
Do they eat each other too, or just kill each other?
No, they eat each other. Yeah, we found rattlesnakes in bull snakes and vice versa, and rattlesnakes in
The
rattlesnakes.
first time I skinned out a rattlesnake a few years ago, a big guy, he had a pretty good sized rattlesnake inside. I didn't think it'd be possible. First guy I called, that's what they do.
Yeah.
Cannibalistic, they call that.
Yeah, cannibalistic.
Are they immune to the venom of the rattlesnake then, the bull snake?
No, they'll get sick from it, but it's not like the same sickness that
Not like a
humans
lung.
get. Yeah, not like the same sickness, yeah. All right. Okay. All right.
Nope.
The door's locked.
Why you keep putting your feet up?
Because I'm really freaked
I know
out.
they could strike way up here.
False sense of security, Paul.
Okay, if you want to see, you can kind of walk on up. They can't run too fast. It's not a mama. So you can come up because I'll bring it around, but let me see how it acts first, okay? This one's brand new, so we'll see.
He got on the den about 3 days ago. He's hungry, he's gonna come out. We'll have one out here close.
Just do one. Yeah, he's hungry. So see, he's watching me right now. Now see, you can say, oh, that's not very far, but half his body length is going to put him right there. So, that's,
On a hot day, they'll go farther than that. I've seen them go full length and then some.
all right, where's that?
You want to do this? Okay.
I always do that when I turn my back. I have no idea why. So. Okay. This purse actually has, now see, I'm just kind of agitating it. There, see, it's just giving me a warning strike. But then you start bothering it like somebody. There's the venom on there. See a little bit of venom on there. But see, all he was doing was warning me. Just leave me alone. I was in there, I was sleeping just fine. Leave me alone. And a lot of times it takes 2 or 3 strikes before they really release a lot of the venom. So a lot of times if you just encounter one, they may just do that fake strike at you, which is enough to usually make most people run.
So is that why they say like only 30% of the time they release their venom because they're warning you, or is it just?
It's actually, they release their venom about 75% of the time, but 25% of the time it's totally dry. And that's kind of a warning bite. We're too big to swallow. And he really doesn't want anything to do with me. But I'm getting mad right now. So, but you can see this is where he's all ready to strike. Let's see, he's watching me again. And he's sensing that heat. And when I'm behind him, he can't see. He's looking for you, he's looking for Roger right now.
How old do you think that one is?
Now see, what he's trying to do is twist so he can get his head around. See the vertical pupils? Pits? Right there underneath his nostril. Look at his tail. Look how flat he is. He's just trying to twist around right now to get a bite of my arm. See how flat he is right now? He's hungry. He's completely empty.
That's like a physiologic effect that they do to flatten out so they can manipulate
Yep.
better.
Yep.
Can you tell how they are by the rattles?
Actually, up here you can, because they shed a rattle every season. But down in Texas, they may shed 3 or 4 times. Up here, our season 2 rings per year, so 1 shed to 2 sheds per year. So this one is 1, 2, 3, 4, 5, 6, probably 6 years old.
So that corresponds to that when they shed their skin?
Yep. Yep. And they get another.
They usually shed twice.
Yeah,
And when they
twice.
come out of their dens in the spring, I find a lot of shed skins around, so they did. And then usually about midsummer, September, August, you find out more sheds.
Do they always hibernate with other snakes, or can they be by themselves?
Well, we've had them go individual into holes. I've got a couple right now. They're by themselves. We aren't sure yet if there's going to be other snakes, but generally speaking, they go in a community dens. And there's bow snakes, garter snakes, they're all in there together.
So
I
is that
even
their-
have a toad that lives in a couple of my dens.
Is that their opportunity to mate then when they wake up? Do they mate
They
because
make
everybody's
during
there?
in early spring, Yep, that's when they mate. And in this part of the country, they only mate or have young
Well, right now,
every 2 or 3 years. They don't have them every year. They can retain the egg and the sperm in their body for 2 or 3 years. But it's a female thing. She says, well, I'm not really ready to have babies this year. She might want to this year. About every 3 years.
Actually, the biggest that they recorded in Montana is like only 56 inches, but we're aware of larger birds. So, yeah.
Everybody talks about all the big snakes we get. If they've caught their own. So when they do that, I always bring this one up and say, oh, you know what a big
That's a diamondback.
This came out of Texas. I'm 6 foot. I'm probably 7.5 foot rattlesnake. If you meet this guy in the mountains, not going to walk very far. The big rabbit.
Yeah, the blue tubes are here. Okay. All right.
Just make sure they don't mess with the rattles. There's.
You're gonna say, Gavin. Oh yeah, man.
Anybody want it down there? No, I guess that we're good.
You don't have to be crazy to do this stuff, but it sure helps. It sure helps.
All right.
No offense, Doc.
All right. Okay, so now let's talk about what we do after we play with them like that. So, besides, what's the first thing you should do?
Wash your hands.
Wash your hands. It's probably, they have salmonella. They do. Salmonella is endemic, so I'm not going to rub my nose or mouth right now. So, or have a sandwich. But, yeah, anyway. So, snake envenomation, 98%. I didn't know that. 98% of the envenomation in the United States is from pit vipers. And it's from just what I just did. Let's pick it up, let's see how fast it is, let's have another beer, or hold my beer, let me show you this, and that's what usually happens. So legitimate bites, here's how I divide it. The legitimate bites are the bites that we all worry about. We're hiking a trail, we don't hear it, step on a snake. It is really, really rare. It used to be about 40%, almost half of snake bites. Now snakes have gotten accustomed to humans. They get out of the way. Rattlesnakes often don't rattle. Because if they rattle, somebody that's had too many Budweisers is going to try to fight them and pick them up. So, not that that's ever happened.
If they're threatened, Doc, generally they'll warn you.
Yeah, yeah.
If you're not threatened, you walk right by them.
Yeah, you would never even know they were there. But if you're close enough to hear that rattle, by the way, not everybody can, mostly guys, we have bad ears. I'll be the first to admit, I can hear a rattlesnake. But I can hear a rattler, but a lot of guys lose that sense of that soft rattle, so they can't hear it. Girls are really good at hearing, very good. Hypersensitive, so. You hear it, right? Okay, so many bites can be dry, like I was talking about. But this only accounts for less than 25% of the bites, where you just startle a snake and step on it. Illegitimate bites, the snake's provoked, attempted to handle. As you saw, he was trying to twist around. And if I would have let up a little bit, he would twist around and just tag me that fast. And it often results in multiple bites. My favorite story, I had a guy in the Beirut, there's something first off. And of course he had Budweiser. And he came in with a bite on his finger. And his finger was all swollen. And he's like, yeah, I got bit by a snake. I said, but there's like 4 fang marks in there. I said, yeah. My buddy said it was fast, but I didn't believe it was that fast, so I put my hand in the cage again. So twice. And the other thing, illegitimate bite, a lot of, you kill a snake and you play with it, that venom is still quite active. I've seen kids with snake hits on sticks, shaking it at other kids. If they tag you, it can envenomate you. One of Roger's friends, I think, was helping Roger skin snakes, ones they had to destroy, and scratched his finger. And how long was it in the freezer?
He'd been froze solid many hours, if not even a day or two.
Yeah.
But we were taking the venom was still active for
Quite
some
active.
reason.
Quite active.
But I think you said if it's froze, it'll maintain its toxicity
Yeah.
longer than if it's out dry.
Yeah.
Like that bag is probably safe to touch now.
Yeah.
Almost.
Almost.
But is that true? I mean, we're learning something. If it's froze,
Yeah.
then it'll maintain it. So take one home and freeze it. Don't play with it when you get it out.
So this is how you get bit. This is actually fertile ants, by the way. San Diego in Costa Rica, and I had a wrestling match with it in the water, because they told me they were never in the water, so I'm walking in the middle of the water. There's one right on the top of leaves, right in the middle. Went through my legs and around, and then swimming a little bit. So anyway, so what are your odds of being bitten? You have a better chance of being struck by lightning. But, as you might have gathered by now, there's inherent risk factors that's directly related to the teeth. So, do you have testosterone? There's one risk factor. Teenagers, 2 risk factors. Inversely proportional to the number of teeth. That's 3 risk factors. 4th, tequila. Definitely a risk factor. And 5th is ugly tattoos.
How about a snake tattoo?
Yeah, some of those aren't ugly. That's a. Okay, so the severity of the bites, about 50% are what we have to treat. And so half the bites that you encounter, you're going to have to treat if it's from a pit viper. So we'll not get into the venom other than it's super complex. It used to be like 20 to 30 proteins and enzymes. It's over 100 now. One of the best resources that you should have on file and up is the Wilderness Medicine guidelines. That is probably the most up-to-date practice guidelines. So I would definitely print those and keep them handy. Got dosing of anti-venom, first aid treatment, which you're going to find out there's really not much you can do, and it's just an excellent resource. So you're looking up to date is always very good too. But Wilderness Medical Guidelines is probably the latest stuff out there. So traditionally, venom was either hemorrhagic or neurotoxic. But now we recognize there's like cardiotoxins, coagulants, anticoagulants, cytolysins, which is playing a bigger part because a lot of these antivenoms that we use don't reverse the cytotoxic effect, which can cause skin necrosis. And some of the antivenoms, including the brand new anti-fab, it has not been tested. Does it prevent cytotoxic effects from it? So neurotoxins, not the prairie rattler. You're going to take that. So the prairie rattler actually has a neurotoxin in it. It's one of the few northern snakes that have that neurotoxin. So both snakes here, all 3 snakes here in Idaho have neurotoxin, but their main effect is hemotoxin, where the blood thins. Okay. This is hard to see, but basically it just says you're bitten by a snake, all those components of that venom can affect almost every system in your body. Big ones, of course, being anticoagulants and neurotoxins. Causes GI bleeds, and some of this is going to give you a clue on how to treat the snake, which I'm going to go into here. So, you've been envenomated, if you have, first off, if you have puncture wounds. And if you have puncture wounds in your hand, I think this one's hard to see. Yeah, really hard to see. If you have puncture wounds, then you've likely been envenomated. If you have any pain, any swelling after the bite, you have been envenomated. And then the process of how do we gauge this starts. So, what do you do in the field? There's a ton of things out there. Bottom line, nothing works. Okay, I just to summarize it briefly. That nothing works. So it used to be this article. I actually met this guy. He went down to the Amazon. He actually likes his whiskey a lot, and went down to the Amazon and studied 20 snakes. He had no idea whether they were pit vipers, colubrids, and he would have natives that would get bitten by these snakes, and he didn't know if they were venomous or not venomous, but he would give them all a little electricity bolt. And he published this article. Out of like 200 and some bites, this seemed to help most of the natives. Well, probably because they weren't venomous snakes to begin with. But anyways, it hit the market. He made a lot of money on it, and he still likes his whiskey. So probably better whiskey now.
Question, Doc. So a strong shot or voltage of electricity will not neutralize that?
Nope, only causes more tissue damage.
Okay.
So those little battery operated.
I know a couple of vets that swear by it.
Doesn't work. Doesn't work. Harmful kits. This one got a 5-star review. These are the old Boy Scout kits. They're cut in sock boards. You know, you put a tourniquet on, you cut it, and it supposedly sucked out the venom. Once it envenomates you, it gets in the tissue and it spreads by direct tissue spread and lymphatics. Unless you do it immediately, and that's what the Sawyer product that came out, this mechanical suction. Unless you do it immediately, you will get less than like 3% of the venom out. So it really doesn't do any good. The Sawyer product, and I have this video of the Sawyer, and I actually talked in Tucson, and I didn't know the Sawyer rep was out there, and I was just slamming him. I was slamming his product, and he said, well, you know that's wrong. He said, we got 30% back, and I said, that was only one study, and we've reproduced that like 15 times, and nobody's ever reproduced that study. And then he was pretty quiet after that. But the one thing about that, it does no harm, and it actually reassures the patient. You know, if you're doing something, you're not sitting there saying, "Ooh, too bad." So, you know, you're doing something, so it reassures them. So the problem with these things is, you know, these types of kits usually lead to what we call samurai medic.
Samurai medic.
You can cut once and stuff, maybe cut 20 times and stuff. This is actually a patient's finger that got a little excited. And all this does is add more tissue damage that we have to repair later. So, constriction bands. Yeah, no. No. So,
And buddy did that one time.
I know.
It didn't work.
I know. Constriction bands. The big thing about constriction bands is, first off, they don't work, and second off, it causes a tourniquet, which causes more necrosis of the tissue. So we don't recommend that. Don't put a band on the wall. In fact, when you're, go ahead.
When your stricture will the venom is coming back in the veins towards you. Arteries go out, veins come back. So if you put say you're bit here, you put, and say you've got hollers here in the back country, a restrictor will slow down.
No, it doesn't. It goes through the tissue.
Everything I read and told is all gone down
Yeah,
the
it goes through the tissue. In fact, it causes more damage when you put a constrictor.
So that rubber band I take when I'm out snaking?
No. Sorry, Roger.
I might have to delete that one. Or have you?
Yeah. So, the mechanical incision, or mechanical suction, which I talked about, it probably does no harm, but it really doesn't help. So, big thing is, rest reassured, try to identify the snake. It's easy here. It's going to be a prairie rattler unless somebody's got an exotic snake in their house, which is not uncommon. I don't know if it is here, but in Missoula. Oh God, it's not uncommon at all up there. So to have exotic snakes in the house, and but get a good look at the snake. But it's going to be a prairie rattler here for sure. Yeah.
What about ice, if you have it?
What about what? Ice?
Ice.
Great question. Ice actually is one of those things. I actually did a case review, a legal case review of a person that they packed his leg in ice and his whole leg turned necrotic. But ice actually causes vasoconstriction and the venom just causes just massive tissue damage. So absolutely no ice. So yeah. Yeah, it's a great question. I'm glad you brought that up.
About whiskey?
Just for the guy that's taking you. So. You might buy him a bottle for taking you to the hospital. So, okay. So the absolute don't cut it, don't suck it, don't freeze it, don't shock it, don't grease it, meaning don't put a bunch of salve on it because it doesn't do any good. We just have to pull it off. Don't get plastered, which is what Roger was just talking about. And then, of course, don't delay transport. Just don't waste. Okay, so here's what we do. And for us that work in the hospital, here's what we do. First, when they come in,
Can you elevate it? You can say elevate it above your heart.
that's it, yeah. So,
Elevate it above your heart.
yeah, and that's, I'm glad you brought it up. It's coming up in this slide. But there's no literature that says that that helps, but there's no literature that says that that hurts. Now, the one thing that you'll read that is out of Australia is they do what they call a compressive wrap. And that works for the elapids that they have in Australia. It's never worked for the United States, and definitely not pit vipers. So what they do is they immobilize your extremity, and then they do a compressive wrap, which pretty much just squeezes that extremity. And it prevents the spread of that elapid venom. And they have very good studies in Australia. That's where they have tiger snakes and brown snakes. And we don't have any of those here. We've tried it on our elapids, which are the coral snakes, and it has not had the same effect. So.
What about activated charcoal on it?
Doesn't, yeah, we've tried that too. That's a great question. So first confirm envenomation. So if it's a dry bite, you probably aren't going to have, if it's not a pit viper, you're probably not going to have fang marks, but you might. But you'll have no pain, no swelling, no systemic symptoms. If it's mild, and this is why it's important to know because right here is where the cutoff is for the antivenom. If it's mild, you'll have fang marks, a little bit of pain and swelling, and then local tissue changes, but there won't be any systemic signs and symptoms. The lab values will look good. And after that, the lab values are what changes, and you'll have a lot more swelling at the site, and your lab's going to go crazy on you. So right at this mild part is when we make the decision to use antivenom. If it's moderate or severe, antivenom should be started right away. Don't delay. If it's mild, there's really good literature now that says, let's say it's just a hand that's slightly swollen. If it's mild, there's good literature that says watch them 12 to 24 hours. And if it doesn't progress and labs don't change, checking lab every 4 hours, and I've got a slide that says this, then you're pretty safe to send them home. The antivenom is not going to be that helpful. But if any of that changes over the next 4 hours, 8 hours, 12 hours, then they go down the antivenom route. And we'll talk about the antivenom route here. So here's your pit viper bite. A couple little holes in the finger, there and there. A little scratch from there. A little bit of vasoconstriction, but kind of a, say, well, that doesn't look so bad, but look at the end here. Either you saw him up the end of his finger, it's really puffy around the end of it. That finger's pretty edematous. So he's been envenomated, but right now all I'd say is that's a mild envenomation. But you check lab, and let's say his platelets are starting to drop, then he's envenomated. Then it goes into moderate, so he gets antivenom. This is the guy that you were asked about. This is the guy from West Virginia. They took the ice off, and a nurse sent me this picture and said, is this a problem? And he's bitten, right here, there's the fang marks right there. 8 hours. It's 8 hours. And yeah, it's a little swollen, the ankle, it's lost its, morphology. That's 8 hours, he's still bleeding. He's anticoagulated. His platelets were 10,000 when they finally did a second test on him, which was 8 hours later. 10,000, and he almost died. And that's why they sent him to us. So it's kind of a sad case, because he was held at one hospital for 6 hours and transferred to the University of West Virginia, which was, kind of reminds me, that's when my son's going to ER residency. I'll have to remind him. This year, yeah. It's yeah, cool. Replacement. So anyways, and it took him 2 hours at the University of West Virginia to even pick up the thrombocytopenia. So he was in the hospital for quite a while. So ABCs, description, mark the bleeding edge, immobilize the affected extremity. They stay at the level of the heart. No proof or literature says below or above, but for lack of better things to do, even in the pre-hospital setting, immobilization is fine. Get an IV, and then we do labs every 4 hours for dry or mild bites, and every 2 hours for severe bites. And you should monitor this circumference. You'd be surprised how fast your extremities swell. And just like with a hand injury, what should come off? Rings, watches, things like that should all come off. Lab studies. I'm fun about this. I really don't know why we do a D-dimer. It's always positive on everybody anyway, so it's kind of like it's going to be abnormal. But the most important is your blood count, PT, PTT, and fibrin. And sometimes you'll get fibrin split products, but most of us just get fibrin. And these on moderate to severe should be monitored every 2 hours. CPK, you could probably stretch it out to 4 hours, but these four are CDC, PT, PTT, and fibrin every 2 hours. And because that's when you're going to decide when to stop the antivenom or not. So in the ER, yeah.
What are you looking for in the UA? Drugs?
What's that?
What are you looking for in the UA?
Oh, actually, they'll actually get blood. They'll start to sink blood into it. Yeah, drugs too. Usually blood alcohol is important in there too. So initial wound care, look for retained fangs, things we forget about. I mean, you're all excited because you guys, well, I'm excited because somebody's got a snake bite. Person's not usually excited about it. And then don't forget tetanus. Clean the wounds just like any other puncture wound. Splint, elevate, and don't use antibiotics. There's no proof that antibiotics help in any way. Initially. Hospital managed, no envenomation like I was talking about. 8 to 12 hours, they can go. I would be really cautious if I was in northern Idaho and somebody said, yeah, this is kind of this black looking viper that was pretty big and it bit me. I would watch him 24 hours because that's that northern Pacific rattlesnake.
Is the crowfab effective on that?
Mm-hmm. That crowfab is effective on every pit viper we have in the United States. Great question. Mild envenomation, here's the newest literature, is hold the crowfab. Wait 12 to 24 hours. If they start to change or get worse or the lab gets worse, then start crowfab or antibite, which is the new stuff. Modern envenomation, crowfab, or antibite. And we'll talk about those. After you've stopped the progress of the disease, then you watch them 24 more hours, and then you can restart. So, and then ones, if you're down in the Southwest, Mojave rattler and the Northern Pacific rattler, which is up here, you should keep them longer. So here's the contenders. And this is so unique because, our big gripe with crowfab, which is a great drug, by the way, is that it costs so dang much. It's 4 to 6 vials. I don't know what you don't have to tell me, but most hospitals charge about $5,000 a vial, and so the initial dose of crowfab is $20,000. So along comes antibite, which is made out of horse serum, a fat fragment too. They cost $1,200 a vial. You're thinking, yay! But then the advice is you give 10 vials at a time. And with markup, it's probably going to be exactly the same price. In fact, if you look at cost, Crofab's about $3,000 a vial, roughly. Antibiotics $12,000 a vial. So 4 times 3 is 12. 10 times 12 is 12. So magic how that came out. I don't know how they did it. They're different drug companies.
So what do you use?
We'll talk about that. You can use whatever you got. But basically, Crofab, good for all North American snakes. It's papain cleaved, so what that means is if you're allergic to papain or papaya, which is a pretty rare allergy, but if you do have a papaya allergy, Crofab and Antivite is probably not for you. Or if you use it, start very slowly, which is what is recommended anyways, is you start slowly. About 25 cc's of the entire amount in the first 10 to 15 minutes. If they don't have a reaction, then you can start doing this quicker. It's best if it's given within that first 2 hours. So the way we do this is we mix up like 4 to 6 vials, depending on the snake, usually 4 or 5. And we mix it in 250 cc's of saline, and you run it in over an hour. After that's in, you wait an hour, recheck labs, and if the labs are still going bad or have gotten worse, get another 4 to 6 vials. They can wait another hour, and if they're still going bad, get another 4 to 6 vials. Most I've seen given, we had a patient in Dillon got 24 vials of Crofab antivenom. And then after it stops, you give 2 vials every 6 hours for 3 doses. Now, the reason we do that is just think about it, the physiology of a snake bite, it's in the tissue. So yeah, Crofab's in the circulation, and it's neutralizing that venom. Well, still venom is seeping into the central circulation. Crofab's eliminated from your circulation pretty quick, usually within an hour or so, a couple hours, and it's gone. Where Antivite is a bigger molecule, and it actually stays in your bloodstream about 6 to 8 hours. So what we have seen is about 30 to 40% of the people that are given Crofab, after those two vials every 6 hours, bleed like a day later, 24 hours later. It's because of Crofab. There's still venom in their system, and the Crofab is washed out. And that's where the guys from Wyatt got pretty smart, and they developed Antivite. Interestingly, they used Bothrops asper, which is Fertile ants, a little bit different, and then they used a South American or a neotropical rattlesnake. That's what the Duresis is, and it's got a large fragment, so it stays in your circulation a lot longer. So they've done 3 clinical trials now, but they're not huge because it's kind of hard to get people to volunteer to be bitten by a snake, and badly enough they have to get the antivenom. Really difficult, actually. And then saying, well, this is an experiment. We don't know how this is going to work, but you know, if it turns south, we'll give you the other antivenom. But what they're finding is, with the Antivite, they haven't had that post-antivenom bleeding that they're seeing with Crofab. So that's the big advantage of it. There's not really a price advantage right now, but the big advantage is that you may not have that post-antivenom bleeding. So if you do start having post-antivenom bleeding, you have to, you know, we used to think, oh, we got to give them platelets. We got to give them more platelets. If there's venom in their system, the platelets you give them are going to get neutralized. So you just have to give them more antivenom. So the key is, both of these work. Antivite may have an advantage. It's made with horse serum, but the side effects or allergy profile is identical between the two, which surprised me because there's a lot of people with horse serum allergies. But the side effects profile is the same.
So on that horse serum, if you had subsequent, so if you got bit later on in life and you had the same serum, then is the risk higher with the antibiotic?
No, it's the same. It's flushed out and you don't gain, an immunity or, you don't gain a memory cell to that. It's a passive immunity, so it's in your system and it goes out. It doesn't cause any active immunization. Good question.
Did you talk heart attacks and so on your? You might save your life if
Oh.
you have a heart attack and you get the pill.
Yeah. Well, you can imagine 24 vials of antivenom at about
$100,000.
It was over that. It was $6,000 a vial. And that's just the venom. So not to mention the 3 days in the hospital with the
So you have a choice
special care.
of you die from the same night or have a heart attack.
Yeah. But we can cath the heart.
Yeah. I believe
Okay.
that.
So antivenom reaction, if you do have a reaction to antivenom, epinephrine, steroids, kind of like we do with any of the other things. So if you have any serum sickness reaction, a drug reaction, reaction to the dye in the X-ray, what do we do? If they're real bad, epinephrine, but usually antihistamines and steroids. And it's the same thing for snake venom too. Okay. If they get hypotensive, crystalloids work, but that's usually, again, a component of just a lack of venom, antivenom needed. So, compartment syndrome is very rare. I see this done way too often, way too early. But compartment syndrome, when the swelling develops so much, it actually cuts off the circulation. Really dosing the antivenom appropriately prevents compartment syndrome, but a lot of times people get filleted unnecessarily, which is okay, but it really delays that treatment and the healing of the tissue. So antivenom first, if they absolutely need, to have a fasciotomy, then that's okay. So deaths usually occur because people haven't sought help. Without antivenom, about 2.5%, 3% of people will die from a pit viper envenomation. With antivenom, less than 1%. In fact, in the last 5 years, nobody's died after receiving the antivenom on time. And so nobody's died that has received it. Okay. So, summary. All patients with pit viper bites, even if you think it's dry, should be admitted, at least to observation. That'll vary depending on the species, but that which we talked about. Dry bites, at least 8 hours. I would recommend 12. So write down that wilderness medicine guideline. That's really, really, really good. And I think anybody can download it, but if you can't, let me know and I can download it for you. It's called WMS.org. Go into their practice guidelines, and it's a really, really good. And then special considerations for the Northern Pacific rattler and any exotic snake that somebody may have hiding in their house, just for a pet, definitely admit. Remember, exotic snakes, your antivenom is going to be different. These are Crofab and Antivite are only for pit vipers. So for exotic snakes, I think the University of Utah has some, but I know Spokane Zoo actually has a ton of antivenom. Okay. So I hope that's helpful as far as understanding snakes and snake behavior. Big thing to take home is recognize them. They're curled up like that, snapping at your leg. Probably a good idea to leave them alone. So if you do get bit, you can keep it immobilized at the, if you're bit on the leg, you're not going to have them immobilize your leg and carry them out. You have them walk out, but seek help. There's nothing you can do in the field. And then for the providers here, at least 8 to 12 hours for everybody. And then mild envenomation, 24. And then moderate and severe envenomation, it's up to whatever your pharmacist carries. If it's antibiotic seems to have kind of an edge, but remember, this stuff just came out. I think Joel just got the literature 3 weeks ago, maybe, on it. Yeah, it just came out. But the studies have gone on since about 2008, but still they're not huge studies. Right. Questions? Yeah.
Is there any advantage to snake bite boots?
Yeah,
Did you go
yeah.
higher than that, or?
Yeah, actually, the boots or chaps. You know, if you're in an endemic area, I have probably, even our little fella here from Salmon, most of the people that have been bitten by a snake, other than guys that have had too much Budweiser, are bitten right below the knee. And those chaps make a huge difference, or boots make a huge difference. The Costa Ricans, they wear these crappy rubber boots, but they wear them because that's 95% of the time where a fertile ant is going to tag them at night, you know, right below their kneecap. And yeah, I couldn't. They wear them, so that's why they wear them. So. The questions?
So if you're people are out back or wherever, and they're a few miles from anything, how long do you expect if you had inflammation before you really start swelling?
I'll tell you what literature says, and then I'll tell you an embarrassing one. So it's a great question. I get asked it all the time. So in the backcountry, as long as you get in within 24 hours, that's about how long it takes to progress into that severe envenomation state. It's pretty darn rare that it progresses any quicker than that. Now, my embarrassing moment was in the ER with a core system, and we had a snake bite come in, and I'm like, this is, last time, don't worry, no swelling, nothing. And it was on the foot, and it was a prairie raptor. They got there within an hour. I did a CBC and played the count, 8,000. It had hit directly into the venous system, and so it was a direct injection. And so I ate crow, but I gave a lot of antibiotics to that person. So they were pretty sick. They were sick for quite a while. That's the one that took 24 vials. So, but that was a direct injection into the venous system. So 24 hours in the backcountry. One of the things that I tell guides a lot of times, because if you're on the middle fork of Salmon and you're bitten, it's a big deal to kind of get air flight into it. It's kind of a big deal. And people always argue because they don't want to leave that trip. So what I usually tell them is, do like you do it in the ER. You said, wait 2-3 hours. You make a deal with them and say if there's any swelling, any pain, and you watch it and mark it, then you're out. And most people will agree with that, And 25% are lucky, but a lot of times within an hour, they already know it's affecting them. But best advice is start heading down if you're way in the backcountry. Question?
As an EMT in down river, you call them down and you find somebody there outside watching for the swelling. What steps should you be taking? And also with those steps, what about oxygen?
Oxygen, go by the oxygen sats. Anymore, and this is one of the ping pong things with oxygen. Everybody got oxygen before. You had a sore toe, you got oxygen before. Now it's like, okay, 91%. And then the latest thing's 93%. I'm like, who comes up with this stuff? If they seem short of breath, or their oxygen saturation is in the low 90s, supplemental oxygen. It does not do anything as far as the treatment for the envenomation, but it may make the patient more comfortable, and that's what you do. Immobilize the extremity, wherever it is, and then transport. You got it. Good question.
Doc,
Yeah.
what about the nickel taste?
Oh, that's cut.
and so forth.
Yeah.
'Cause I know of situations where one person they even took said in 5 minutes they were getting effects in their mouth.
Yeah. So one of the, that's a great, thanks Roger. One of the cofactors in the venom is they have metallic cofactors in there. So people that are truly envenomated and it goes systemic on them, they have this funny taste in their mouth. And it's almost been 100% the people that I have seen. They say, it just tastes funny. And it tastes like I'm chewing nickels. And I'm like, then I start getting, alert. Because that is just an odd symptom. But people that say, I have a funny taste, almost a metallic taste in my mouth, that's because of the venom. And so they're already experiencing the symptoms, the systemic symptoms. So
But within a short period of time like that.
It's super
they-
short. Yeah,
They
it's-
would not argue if it hit a vein.
yeah, super short.
Usually,
Yeah.
if they've been hitting the
Yeah,
string,
usually within the
veins are
first hour.
closer.
Yeah,
Yes, sir.
usually within the first hour. Yeah.
What about with kids? I've got 2, and we had 10 rattlesnakes in my yard last summer. So, is that? I do need you to come out. I would have you come out. 'Cause it's-
Roger, we were talking about that because he does that all the time, and a lot of it's the habitat around your house. You know, if there happens to be, and I don't know, you know, but there's rodents around the house, mice, things like that.
Everybody has acreage, and so everything's spaced in tall grass. So yeah, and we're up against the
You're
field.
around home for 2 reasons primarily, something to eat and a place to hide.
Yeah.
If you can get rid of the food source with some kind of hardage, you can. Hire a couple cats, put out bait and so forth. And then take out all the boulders and rocks and places for them to hide.
My
Because
whole
they're-
hillside is like a rock slide
Yeah.
too, and my little people like to just hike everywhere and swim.
That's where
Yeah,
they're gonna be.
that's where they're hiding. That's where
But what we do, we locate the source, and that's the dance. Until you locate the source and reduce the numbers, you're gonna have to learn to live.
That's what Roger does, actually. A lot of people call him and he'll go out, look at the habitat and say, there's the problem.
I can just about tell you where
Do you
you're
have a card and I can get a hold of you?
What's that?
Do you have a card? And
I sure do.
Okay, I'd like it.
a little far, I'm up to my ears in snakes right now, but I'll give you my card.
Yeah.
If I have I don't have it with me, a little packet of information that's sent to people. There's some things you can do around your home to help your problem, and I'll send it to you if I can get your address.
The dog vaccine is not effective in humans. It could be, but it's never been effective in humans.
Is it effective in the dog though?
Yeah, it actually is fairly effective in the dog. And I know a lot of vets that say the same thing. Why don't you just give yourself one of our vaccines? I'm like, it's odd. You know, I'm game. You know, we'll see what happens, but it's never been tested in humans.
But the Red Rock vaccine is effective for dogs.
Yeah.
Helps.
Yeah. Yeah. So.
What about the venom for the little one versus?
So you come up here, and you can do that here in a bit. There's a little tiny critter in there, and that's a baby rattlesnake. They don't have more potent venom, but what it is the smaller rattlesnakes can't control their venom apparatus. So this big guy, as you saw in that purse there, struck, didn't let out much, struck the second time, let out a little bit. If I probably would have agitated him more, he would have sprayed venom all over that purse. And so they have that ability to release a specific amount of venom. These little guys don't. They bite you and they just give you everything you got. And, and because they just don't have that capability. But yeah, you'll see that little guy in there, and yeah, he bites you, he'll hang on for a while. So.
Isn't that kind of a myth, that the little guys are more dangerous?
It's only because they can't control their venom apparatus.
Tiny little venom sack, tiny little, he's big. I just can't bite him.
Yeah, you'll get venom out of that little guy, but not as much. You're right.
So they're safe.
Yeah. So really,
People think
one
they're
in the
not.
United States that actually
Not right.
has the most envenomation is the eastern diamondback. Because when it's mad, it has a massive amount of venom in the druvenois glands. And the same with the bushmaster. Bushmaster is the deadliest pit viper in the world, and bushmasters in Costa Rica too. And they can grow up to about 14 feet, 15 feet, about 20 some pounds. And when they bite you, they're going to release such a massive amount of venom. It's not like their venom's more potent, but you're just like massively saturated with venom. So don't, although I have been looking for them, but really don't want to go messing with those guys. So.